From typing on computers to playing sports, repetitive activities can be harmful to the hands and the wrists, but there are treatments that can bring relief to people who suffer from carpal tunnel. Director Michael Kim joins us in the studio now to tell us more about what to look out for and things we can do maybe to help this and prevent it. Good morning.
Good morning.
So we were talking about this a lot of times. I was even saying, on my cell phone a lot, my thumb starts to hurt in this area. Is that carpal tunnel or is that something different?
Usually it is. So, compressive neuropathy where the nerve is choked, my analogy is everyone's experienced this, when your leg goes to sleep. So your nerve's getting compressed, so you get tingling. So carpal tunnel is where the nerve's compressed in the wrist. And it's so probably about 5% of people in the United States get it.
Really?
And so when the nerve gets compressed in certain positions, it sends numbness and tingling down the fingertips and pain. Sometimes at night wakes you up, shakes the hand. Those are common symptoms. And it's often related to work, although we know by scientific evidence that doesn't cause carpal tunnel work. But work can exacerbate underlying carpal tunnel.
And when we say work, what exact things do you mean? Like typing on a keyboard, right? If someone's typing
mostly
all day long.
repetitive, competitive, repetitive keyboards, workers with small fabricators, etc., like that.
Interesting. So is there anything that we can do just maybe on a daily basis to hopefully prevent carpal tunnel? Can you reverse it if you
a lot
have
of studies on ergonomics, so positioning your hands, any activities you do repetitively like driving, keyboards, whatever you're doing, try to keep the wrist neutral. What often happens is patients get severe carpal, on the bottom right picture you can see, and they wait till, they had it for years, the hands go into sleep, finally it's numb all the time, they lose muscle. And basically, it's like, my analogy is like you're choking someone. That nerve gets choked, and finally the nerve dies. Once the nerve dies, surgery often is not helpful.
Really? So you can't even reverse it once that nerve dies?
Correct. So it's very important to get it treated, whether it's conservatively or surgically. And there's basically several ways to fix it surgically. All of these at 3 months show similar results. However, endoscopic shows promise to decrease recovery time. So often, even though there's not a best way, my recommendation is usually try to do it endoscopically. It usually gets patients back to work a little bit quicker.
Perfect.
And so that means that instead of the long incision, standard incision you can see in the top where we make it and open up the whole carpal tunnel and take the pressure off the nerve, is we make 1 or 2 little incisions and take the scope and open it up and you should be back to work pretty quick.
All right, Dr. Kim, thanks for the advice. We appreciate it.
No problem.
We'll be right back.